Today I'd like to tell you a little bit about the Century S study of deep brain stimulation for traumatic brain injury. I've been interested in functional neurosurgery for many years. Functional neurosurgery focuses on treating disorders like Parkinson's disease, tremor, and psychiatric disorders by using modulation of the brain, like deep brain stimulation. Deep brain stimulation is implanting a small wire about the size of a pencil lead into a deep area of the brain, and then attaching it to a pacemaker-like device that's implanted in the chest just underneath the collarbone. Two small wires about the size of a large pencil lead are implanted into an area of the brain called the central thalamus. The wires are then tunneled to a small pacemaker-like device that's placed just underneath the collarbone under the skin of the chest. Perhaps the most important question is, why are we considering a neurosurgical procedure in people who have already had an injury to their brain? We think the use of brain stimulation may partially reverse the loss of function experienced by people with brain injury. By stimulating a central region of the brain that becomes underpowered in brain injury, we may be able to increase the output of this area. By doing this, we hope to restore mental energy, concentration, and resistance to fatigue. The present study is supported by prior clinical research in which electrodes were safely placed in people with severe brain injury. In one subject, significant clinical improvement was linked to stimulation of this same brain region. Patients who had an initial coma and have recovered independent function but have been unable to return fully to their level of cognitive functioning after 2 years are eligible for the study. We're particularly looking for patients in Northern California near Stanford University. However, if you're outside this area, we may be able to support travel related to the study. We expect people to be in the study for 1 year. That includes several visits to Stanford, including extensive evaluations, surgery, and programming of the neurostimulator. Study participants will undergo imaging studies like CT scans and MRI scans, as well as having electrical tests like EEG or electroencephalogram, where a net of electrodes is attached to the head. Our study has been reviewed by scientists at the National Institutes of Health and is being conducted at 5 academic centers, including Stanford University, Harvard, Cornell, the Cleveland Clinic, and the University of Utah. This investigational study has received ethical review and regulatory approval from the Federal Food and Drug Administration. More information is available on the Patient Wing website and on clinicaltrials.gov.